they periodically come and check. Different people come and periodically check. All those people, most of the people who come here.
Okay, thank you so much for being here today. A introduction or overview of maternal mental health.
And my name is Sherifat Magezi. I'm an occupational therapist from the UK, working with the East London Foundation Trust. I have a background in inpatient mental health, learning disabilities, and physical health. And
my name is Dr. Jessica Katanga. I'm a medical doctor back in the UK and have a background in all the different specialties that I've cycled through, but my aspiration is psychiatry.
Okay, so now that you know us, we're going to go around the room just to get to know you, and we're going to make it a bit fun. So you can tell us one interesting fact about you. It can be your hobby, a place you've been to, or just how you want it to be.
Okay, amazing.
Okay, thank you so much. Now that you've told us about yourselves and you know who we are, so we just wanted to share our passion for mental health, because we asked why mental health, why not physical? So Jessica and I have a passion, and this comes from the fact that mental health is a great part of our lives, yet is barely talked about in our communities. Especially for us as Black women, I believe we tend to go through a lot of things and we're very silent about it. This is partly because society makes you feel like talking about things makes you come across as weak. Therefore, with our project, we hope to empower women to become more confident in their health, bodies, and so that they're able to share their vulnerabilities without feeling guilty or judged. Therefore, we hope to change the attitude for mental health in Uganda and globally.
What is mental health? Mental health exists on a spectrum and is a state of mental and emotional well-being, enabling people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. Just like how physical health exists on a spectrum where some of us are more healthier than others, or maybe there's some parts of us that are more healthy than other aspects, it's the same as mental health. Just because we can't always see mental health the same way we can see physical health, like a broken leg, or the same way we can measure it like blood pressure, it still does exist. It's very important, and there are other ways we can see or measure, which we'll talk about later. So then there are mental health disorders. So some common ones is like depression, anxiety, addiction, eating disorders, bipolar, OCD, etc. In Uganda, we've seen that epilepsy, dementia, and cerebral palsy come under mental health, but in the UK, we would say these are neurological conditions. So disorders of the nervous system rather than the mind. So I asked some healthcare staff a few weeks ago for the Uganda version of mental health. So before I tell you what I was told, can anybody shout out, how would you say to a patient if you're wanting to ask them the history of their mental health? What's the Uganda for mental health? Anybody?
For mental illness.
Okay.
But not mental illness.
Okay, so mental illness, what would be the word for it?
So it's like disease of the brain and what is over.
Yeah, so that's a good term for what was this about? So is that a good one as well?
That would mean diseases it's kind of like similar.
Okay, so those ones are all good ones. Because unfortunately before, when I was talking to some people, I was told, because I'm Tanzanian, I'm not Ugandan, so I'm just learning. I was told abanalu, which is obviously translating as madness, and that's not okay. Mental health is not madness, because when we call it that, it creates a stigma and it's quite offensive. The people that we see on the street maybe that are mad, there would actually be diagnoses we could give them, and they should have help available to them. So let's try to avoid phrases like abalalu or the other one. Yeah, and try to use the more better ones.
So now that we know what mental health is, let's look at the symptoms. With mental health symptoms, we have both mild and severe. So it's very important for us to understand that some of the symptoms are more visible than the others, and mental health symptoms can be physical as well. I'm going to move on to the next slide, but before I do, I hope we as professionals understand that we are likely to only find out about the symptoms when they become severe. That is why we have a lot of maybe people with psychosis, because we didn't detect this early on. It's very important for us to be able to see these signs and advise patients to seek medical help, because if this is not done, the condition can exacerbate and people would see things like suicide. Now it's coming from the thoughts and impulses. People will commit suicide, they will take their lives. Then we'll have infanticide, which is killing of babies, poor qualities of life, and other mental and physical health symptoms.
So as we already said, our project is on maternal mental health, and that refers to the mental health of a woman in the perinatal period. Perinatal period is the 9 months of pregnancy and then the 1 year after that, which is the postpartum period. So we have a video for you to watch.
The first 1,001 days after conception are a critical time for babies. It can also be a tough time for parents, especially one's mental health. Tiredness and stress are part of the job. But some moms have to deal with much more serious challenges on top. 1 in 5 women experience a perinatal mental health problem during their pregnancy and in the first year after the birth. All kinds of factors can contribute. Low mood and anxiety are common mental health difficulties, but it's important that they are fully assessed. With the right care at the right time, mums have the best chance of being well and enjoying family life with their baby.
So I hope you enjoyed that video. And to recap with maternal mental health, yes, there's postpartum psychosis, but the most common ones are depression and anxiety. Any of the mental health disorders during the perinatal period can be completely new to the woman, or it can be something that already existed but is then exacerbated during pregnancy.
So now let's look at some of the statistics, the mental health statistics in Uganda. As you can see, the general mental health is 22.9% of children and 24.2% of adults. This implies that that's the number of adults and children that have experienced mental health in Uganda. It's closer to a quarter. If it's 100, that's you know the math, right? So it's like a quarter of that, and then of the population. And then during the perinatal period, we see that 1 out of 5 new mothers and 1 out of 4 pregnant mothers have experienced mental health issues. What does this mean to us? It means that mental health, perinatal mental health is very vital, because if you count 1, 2, 3, 4, 5, the likelihood is that one person has a mental health issue. And that's among the mothers and pregnant women. So for pregnant women, it's actually 1 out of 4. But this shows you, even though we perceive giving birth as a normal thing in Uganda, it can actually have consequences, both mental and physically, and therefore we should not ignore this. Also, if the mental health goes untreated, I mentioned earlier about what can really happen, and some of the things I mentioned included suicide, infanticide, poor quality of life, and other physical and mental health conditions like hypertension, and I believe we've seen a lot of hypertension or high blood pressure on the wards. It can also lead to cardiovascular diseases and other infections related to poor hygiene, because when someone is going through mental health, through a period of mental health illness, they are likely to neglect themselves. So they may be starving, they may not be able to wash up, so they're likely to get conditions related to their hygiene or their health, their physical health. Therefore, we should not undermine mental health, and we should take it quite seriously. Also, it's important for us to understand that people are likely not to report this. We understand in our society, the things are not talked about, and people think when you go silent about things, it's kind of like a sign of strength. Therefore, opening up can be seen as a weakness. So you as professionals, or we as professionals, should be able to look out for these symptoms and advise the patients to seek medical help and just let them know it's really okay not to be okay. It's okay to seek help because, as Jessica said, the physical and mental health are not really different. It's just that one can be seen and the other cannot be seen.
So, what are some risk factors for developing mental health disorders during pregnancy? When we think of risk factors, it's helpful to think with the biopsychosocial model. So, biological risk factors, psychological risk factors, and social. Now, I don't know if we have time for the papers, maybe I'll just ask them to shout out some. So, can anybody shout out any biological risk factors that they can think of for developing mental health illness during pregnancy or mental illness in general?
Hormones?
Yeah, hormones, fantastic. Fantastic, nutritional deficiencies.
I think there was an answer right here.
Genetic?
Fantastic, genetics, family history, yeah, that's great. So now moving on to psychological, so we've talked about abuse from partners or from families. Any other psychological risk factors you can think of? Can we think of any social risk factors for developing mental illness during pregnancy? Stigma from society, exactly. I saw a hand. So a lot of the ones that you already said, we've got listed here. So biological, we already talked about family history, genetics, age, substance use as well is a big thing, and pre-existing chronic health conditions, either mental or physical. Psychological, trauma, stress, if they have coping skills, personal beliefs around mental health, which is the reason why we need to always be shouting from the rooftops about it, because somebody who knows what they're going through, that, oh, actually, my mum went through this, or my friend went through this, they're going to be able to cope much better than if they think, oh, I'm all alone and I'm weird for feeling depressed when I've just had a baby. And social, again, age. So if we say teenage pregnancy, and unfortunately that's a big thing in Uganda, with 25% of 15 to 19-year-old women, females, already having had a baby or are currently pregnant. So somebody who is a teenage mother might have less support than somebody who's a 35-year-old married woman, for example. Poverty, lack of employment, that goes hand in hand. Non-supportive partners, or worse, abusive partners or absent partners. Stigma, lack of family or friends, and then attitudes of healthcare workers as well. And so there are questions for some of these factors on the antenatal cards already. So it talks about employment, next of kin, gender-based violence. And this is the reason they need to be filled in, because it builds a picture of the person sitting in front of you and allows you to better understand the patient and therefore better look after them.
Okay, so now we're going to look at the more personal side of mental health, seeing how patients feel and what they've gone through during their perinatal period.
How early on was really kid.
When I got pregnant, it was a very happy surprise.
Normally she's quite happy, jolly person.
Pregnancy, especially because of the traumatic birth that I had in my first pregnancy, I had to change, things had changed.
The first person I spoke to was my midwife.
I need some help. The more you talk, the easier things get.
Seeing moms that were going through similar stuff made me feel that I wasn't just going crazy. It's a journey. It will pass.
It will pass.
It will pass.
Okay, so as we saw from the video, the hope that we can get from mental health disorders is when we seek help. There's no need to have fear or suffer in silence, because these conditions are all treatable, and here is a list of the different treatment options. And of course, to treat an issue, we need to first identify it. Once identified, then it can be tackled with any of these methods: counselling, seeing a psychiatrist, medication, family support, support and understanding from healthcare workers, and meaningful occupations or activities of daily life. And often, just that listening ear and understanding from us as healthcare workers makes a massive positive difference to someone's mental health.
All right, now that we've given you an overview of maternal mental health, what should we be doing? So myself and Jessica we are creating a pathway between maternal and mental health services. We'll again talk about this in more details in future CPD or CME sessions. hopefully, as we will be delivering more training on how to use or administer the screening tools.
So this is our whole project, so we would really love compliance, because at the end of the time we'll do an audit to see how much news have we been recording. Thank you. Okay, and that's the end of our slides. Thank you so much for listening to us. The key takeaway that we want to say is that it's everyone's responsibility to assess mental health. Mental health is everyone's business. The same way a cardiologist can't say, oh, I'm not going to ask about breathing because that's the respiratory doctor's job, or a doctor can't say, oh, I'm not going to ask about the patient's life because that's the nurse's job. It's the same way we have to all be asking about the woman's mood and mental health during pregnancy, because it has such an overall impact on their health and well-being. And not just for our patients, it's also for each other, to look out for each other. If you see that your colleague is isolated, or any of the indicators of the mild mental health or burnout we mentioned before, then speak to them. You never know what people are going through, and you may be the one person that saves that person.
Okay, thank you so much for your time. And any questions for us today?
Has been pregnant before. You understand that that is a critical period where someone actually needs a lot of support. But beyond that, there is special support in terms of mental health. Yeah? So it's a very critical period, but somehow, because we have so many other competing interests, it's somehow neglected. And actually, until that collaboration started, we actually never knew where we stand as Gombe Hospital and Katanga district. I really want to thank NHS England and the Ministry of Health for actually choosing Gombe Hospital, because